Josep Rodés-Cabau and Mike Gibson talking about patients with small aortic annuli and their treatment with TAVR, the results of the VIVA trial. Talk to us, Joseph, about what you did and what you found.
Thanks, Dr. Gibson. What we did in this investigator-initiated trial was to compare the hemodynamic and clinical results of TAVR versus SAVR in patients with severe aortic stenosis and small aortic annuli, defined as an annulus less than 23 millimeters as evaluated by computed tomography. There have been, in fact, no randomized studies in this particular cohort. And as you may know, this anatomical feature is very characteristic from women, which are not taken also into account in the guidelines, these gender factors. And I think that this was also an opportunity to evaluate this population.
Was it randomized and how many patients?
This was a randomized trial, 1-to-1. We planned initially to enroll 300 patients based on hypothesis of superiority of TAVR on valve hemodynamics. But due to COVID pandemic issues and then the results of the Partner 3 and Evolut low-risk trials, the enrollment was really very slow, and we decided to stop the trial after enrolling 156 patients, meaning a bit more than 50% of the study population.
And what did you find?
What we found, our primary endpoint was valve hemodynamics at 60 days, as evaluated in a central echo core lab, and in the primary endpoint, what we found is that there were no significant differences between TAVR and SAVR regarding severe prosthesis patient mismatch and moderate to severe aortic regurgitation. There was a rate of 5.6% in the TAVR group versus a bit more, around 10% in the SAVR group. There were no differences in residual gradients either, and no differences in the rest of valve hemodynamic parameters. In terms of
So it's underpowered, obviously, with half the patients enrolled. Anything we can take from this for our clinical practice?
Yeah, I think that the message probably for clinical practice, because what I was going to say is that we evaluated also for sure the clinical results. There were no significant differences at 30-day outcomes in terms of major clinical events. And after a median follow-up of 2 years, there were no differences in mortality, stroke, or cardiac rehospitalization between groups. I think that the take-home message is that the two therapies seem to be a valid alternative for this population. I have to say that the results, particularly in the SAVR group, particularly regarding our primary endpoint, which was valve hemodynamics, were better than expected in terms of prosthesis patient mismatch, and in addition to the early cessation of the study, I think that these drive the final results.
Right. Well, I know how tough it was to do trials during COVID. Really, really tough. Rapidly changing field. Congratulations getting as far as you did, Joseph. Thanks for sharing this with us today. And thanks to everyone in the audience for joining us. Thanks.
Thank you very much.